I sit at my desk every month and I play eeny, meeny, miny, mo with my doctor bills. I didn't think it was going to be this way. I remember when I was diagnosed with juvenile rheumatoid arthritis, and it was 1983. And my parents, they were 28, and they had 3 kids under the age of 8. I'm the oldest. And I knew we struggled with money, and I knew that my diagnosis had put a great strain on us. I didn't realize how bad it was until the day that my mom took us to the food bank. My dad refused to go. And I remember when my mom would sit on the phone for hours and call every doctor, every account holder, and make arrangements and say, I'll pay you $10 this month. I'll pay you $10 this month. I'm just trying to keep the accounts current. They were blue-collar workers. It was their first time dealing with an illness, first time dealing with an ill child. They were dealing with the emotional burdens as well as the fear of what this was going to do to their child. Time went by. We learned how to deal with the disease. They evolved. We all evolved. And Arthur became part of our lives. I grew and lived a relatively, quote, normal life, a normal disabled life. And I thought I did things, quote, right. I worked a teenage job and I went to college, and the whole time I knew that I would have to get a job that would support me. And I could work sitting. Obviously, I would never support myself doing physical labor. And I was lucky enough during this whole time to be grandfathered in and continue to have the Medicaid that my mom had gotten me approved sometime in my late childhood under the Katie Beckett Title 19 program, which alleviated the chronic debt that they were falling under. And I continued to be covered under the Medicaid Katie Beckett even when I got my dream job with a national nonprofit organization. And so my health care, even though my health was terribly strained, it continues to be an up and down battle. Life with rheumatoid arthritis, it's painful and debilitating and disabling. It's exhausting, but it is. It is what I know. It's been 36 years. I've had 9 joint replacements, 6 bone breaks. I've been in 6 nursing homes, Shading Pines, if you may. I've had 6 bacterial infections, 1 flesh-eating, life-threatening bacterial infection. And finally, at the age of 35, I had to make the devastating choice to retire. I've still not come to terms with it all the way. What I didn't expect when I medically retired at 35 and went on Medicare was that I was going to lose my Medicaid. And suddenly I was going to be left with 20% copays and 20% of my medical debts for everything that was left over. I didn't expect to suddenly be accruing these mountains and mountains of debts on top of the constant pain and the constant exhaustion and fatigue that rheumatoid arthritis brings. I won't ever get better. This is not something that goes away, and it's not something that I can ever just pay off. With every bill that I pay off, there's a new one coming. There's an exhaustive next cycle. There's the next blood test. There's the next doctor's checkup, whether it's every 3 months or every 6 months. There's always another one. So I feel like it's a whack-a-mole, like it's a constant whack-a-mole. And I spend my time trying to figure out, do I try and catch up and pay this late collections bill, or do I pay this current bill? And it shouldn't be this way. I'm $17,000 in debt. And my cost of care, the cost of care affects everybody around me mentally. My mother worries about me. She slips money in my pockets, and she's now a widow who can't afford her own health care. My family is constantly supporting me in the ways that they shouldn't have to when I'm a middle-aged woman who worked so hard to be an independent, disabled person. And it's exhausting, and also breeds into this depression that I fight so hard not to fall into, because depression goes hand in hand with chronic illness. And so as I tried to reach out earlier this year to try and get some help with depression, I found that suddenly I was paying co-pays on that, and after 5 weeks or 5 visits to the therapist, I could no longer see the therapist because I could no longer pay the copay for that as well. So somehow, in this grand scheme of things, the cost of care is not only about what I owe, but it's about what I can't access. And we have to figure out a way to make this more affordable and more concrete, because we need to live, and I can't afford to live and to keep existing the way things are going. And I am constantly fearing that I'm going to walk into my doctor's office the next time and he's going to tell me he can no longer see me or treat me until I pay this bill. Thank you.